When providing a bed bath, the CNA should begin washing from A. The feet upward. B. The back before the arms. C. The perineal area first. D. The face and move downward. Answer, D. Washing from the cleanest area, the face, to the dirtiest prevents the spread of microorganisms and maintains proper hygiene standards for the resident. During oral care for a conscious resident, the CNA should A. Use cold water only. B. Place the resident in a sitting or semi-Fowler's position. C. Keep the head of the bed flat. D. Avoid using toothpaste. Answer, B. Sitting the resident upright prevents aspiration and allows for safe, effective cleaning of the mouth and teeth. When assisting a resident with dressing, the CNA should A. Start with the strong side first. B. Allow the resident to dress alone. C. Dress both arms simultaneously. D. Start with the weak side first. Answer, D. The weak side is dressed first to reduce strain and discomfort, while undressing starts with the strong side. Which action helps prevent skin breakdown? A. Keeping linens wrinkled for comfort. B. Ensuring the skin is clean and dry. C. Avoiding lotion on dry skin. D. Restricting repositioning to once daily. Answer, B. Clean, dry skin reduces the risk of moisture-related irritation and pressure ulcers, promoting overall skin integrity. When providing perineal care for a male resident, the CNA should A. Clean from the rectum to the penis. B. Wash the scrotum first. C. Use circular motions from the outside inward. D. Clean the penis from the tip downward. Answer, D. Cleaning from the tip downward prevents contamination from the anal area and helps maintain genital hygiene. How should the CNA care for a resident with dentures? A. Store dentures in tissue when not in use. B. Rinse and place them in cool water overnight. C. Use hot water to clean dentures. D. Leave them dry for sanitation. Answer, B. Cool water prevents dentures from warping, and keeping them moist maintains shape and comfort for the resident. When assisting a resident with toileting, the CNA should A. Leave the resident alone without supervision. B. Rush the resident to finish quickly. C. Stand outside the door with it open. D. Ensure privacy and provide the call light. Answer, D. Providing privacy while ensuring access to the call light preserves dignity and safety during toileting. When shampooing a resident's hair in bed, the CNA should A. Keep the head flat. B. Use a shampoo tray and protect linens. C. Use cold water only. D. Skip rinsing to save time. Answer, B. Using a shampoo tray and waterproof protection keeps the resident comfortable and prevents bed wetness or chills. When shaving a male resident's face, the CNA should A. Shave against the direction of hair growth. B. Use long, fast strokes. C. Shave in the direction of hair growth. D. Use only cold water. Answer, C. Shaving in the direction of hair growth reduces skin irritation and the risk of nicks or cuts. Nail care should not be performed on residents with A. Diabetes. B. Dementia. C. Arthritis. D. Hypertension. Answer, A. Diabetic residents have poor circulation and a higher infection risk, so only licensed professionals should trim their nails. When providing foot care, the CNA should A. Soak the feet for an extended time. B. Keep the feet clean and dry, especially between toes. C. Clip thick toenails carefully. D. Massage between the toes. Answer B. Keeping feet dry between toes prevents fungal infections and skin breakdown, essential for resident safety. Before feeding a resident, the CNA should always A. Ask the nurse to administer medication. B. Wash the resident's hands. C. Leave the tray unattended. D. Start feeding immediately. Answer B. Handwashing prevents contamination and ensures safe eating practices for residents. A resident who is NPO means they A. May have only liquids. B. Can eat soft food. C. Should not receive any food or drink by mouth. D. Are allowed water only. Answer C. NPO means nothing by mouth, used before surgeries or certain medical tests to prevent aspiration. When brushing a resident's hair, the CNA should A. Pull hard to dead angle quickly. B. Brush gently, starting from the ends. C. Use a dirty brush to save time. D. Avoid styling entirely. Answer B. Starting from the ends prevents pulling and discomfort, keeping the scalp healthy and hair manageable. When changing a gown for a resident within 4, the CNA should A. Remove the sleeve without disconnecting tubing. B. Disconnect the 4 tubing. C. Pull hard to remove the sleeve. D. Skip changing the gown. Answer A. The CNA carefully removes the sleeve from the arm without disturbing the 4 line, maintaining both safety and comfort. When assisting a resident to use a bedpan, the CNA should A. Leave immediately after placing the pan. B. Ensure privacy and position the resident correctly. C. Place the bed flat. D. Avoid providing toilet tissue. Answer B. Proper positioning and privacy prevent spills, discomfort, and embarrassment during toileting. Which action helps promote resident independence during bathing? A. Completing the bath quickly without asking. B. Allowing the resident to do as much as possible. C. Ignoring their participation. D. Rushing the task. Answer B. Encouraging residents to participate enhances their self-esteem and maintains functional ability. A resident with limited mobility needs oral care. The CNA should A. Use a sponge-tipped swab. B. Use a toothbrush only. C. Pour water directly into the mouth. D. Skip oral care altogether. Answer A. Sponge swabs gently clean the mouth and prevent aspiration in residents with swallowing difficulties. When assisting a resident to dress, the CNA should always A. Dress the resident in the hallway. B. Keep the door open. C. Close curtains for privacy. D. Allow visitors to stay. Answer C. Closing curtains and ensuring privacy maintains dignity and comfort during personal care. Which of the following promotes good perineal hygiene? A. Using warm water and gentle soap. B. Using strong disinfectants. C. Cleaning quickly without rinsing. D. Skipping drying. Answer A. Gentle cleansing and drying protect delicate skin and reduce the risk of irritation or infection. When emptying a urinary drainage bag, the CNA should A. Let the bag touch the container. B. Keep the bag higher than the bladder. C. Use a clean container and measure output accurately. D. Ignore documentation. Answer C. Accurate measurement ensures fluid balance monitoring and infection control by preventing contamination. A partial bed bath includes washing the A. Face, hands, underarms, and perineal area. B. Only the arms and legs. C. Back and feet only. D. Entire body. Answer A. Partial baths focus on key hygiene areas for residents who cannot tolerate a full bath daily. When assisting with oral care for a resident with dentures, the CNA should A. Place dentures in a paper towel. B. Line the sink with a towel or water before cleaning. C. Use hot water. D. Leave dentures dry overnight. Answer B. Lining the sink cushions dentures if dropped, preventing breakage and maintaining cleanliness. When assisting a resident in using a walker, the CNA should A. Encourage leaning on the walker heavily. B. Push the walker ahead for them. C. Allow the resident to run. D. Ensure the walker is properly adjusted for height. Answer D. Proper height ensures safe balance and reduces strain on the resident's arms and shoulders. How should the CNA position the resident for oral care if they are unconscious? A. Flat on the back. B. On their side. C. Sitting upright. D. Supine with head raised. Answer B. Lateral positioning prevents aspiration by allowing fluids to drain safely from the mouth. When changing linens, the CNA should avoid A. Shaking sheets. B. Keeping linens wrinkle-free. C. Holding linens away from the uniform. D. Using clean linens for each resident. Answer A. Shaking linens spreads microorganisms and dust, increasing infection risk in healthcare environments. When assisting with grooming, the CNA should A. Respect personal preferences and styles. B. Use only standard hairstyles. C. Rush through grooming tasks. D. Refuse to help with makeup. Answer A. Respecting grooming choices supports individuality and resident self-esteem. To promote good circulation, the CNA can A. Keep legs tightly covered at all times. B. Restrict all movement. C. Reposition residents frequently. D. Limit fluid intake. Answer C. Frequent movement improves blood flow, prevents clots, and reduces pressure ulcer risks. When dressing a resident with paralysis on one side, the CNA should A. Dress the weak side first. B. Dress the strong side first. C. Skip the affected side. D. Dress both sides simultaneously. Answer A. Dressing the weak side first makes it easier to guide the affected limb into clothing gently. When helping a resident to eat, the CNA should A. Feed quickly. B. Encourage self-feeding whenever possible. C. Stand over the resident. D. Force food if they refuse. Answer B. Promoting self-feeding supports independence and dignity while allowing the CNA to assist safely. The CNA should check water temperature before bathing to A. Ensure it is cool. B. Avoid wasting hot water. C. Save time. D. Prevent burns or discomfort. Answer D. Testing temperature protects residents with sensitive skin or decreased sensation from injury. Which step is essential after toileting assistance? A. Leave the resident without washing hands. B. Assist with hand hygiene. C. Skip cleaning the perineal area. D. Remove privacy screens immediately. Answer B. Hand hygiene after toileting is critical to infection control and maintaining dignity. When assisting with mouth care for a resident with dry lips, the CNA should A. Apply petroleum jelly or lip moisturizer. B. Use alcohol-based products. C. Ignore dryness. D. Apply lotion. Answer A. Lip moisturizers prevent cracking and maintain comfort without causing irritation. A resident's hearing aid is not working. The CNA should first A. Throw it away. B. Soak it in water. C. Replace the battery. D. Report it broken immediately. Answer C. Many hearing aid issues result from dead batteries. Checking them first can resolve the problem quickly. When assisting a resident in using a cane, the CNA should A. Place the cane on the weaker side. B. Place the cane on the stronger side. C. Hold it for the resident. D. Use two canes for support. Answer A. The cane is placed on the resident's weaker side to provide support and balance while walking. It helps shift weight away from the weaker leg and reduces the risk of falls. When helping a resident with incontinence, the CNA should A. Keep soiled linens for reuse. B. Change soiled clothing promptly. C. Avoid reporting frequent incidents. D. Restrict fluids entirely. Answer B. Prompt cleaning and changing prevents skin irritation, odor, and infection. When performing perineal care for an incontinent resident, the CNA should A. Use hot water. B. Use one towel for multiple residents. C. Skip rinsing to save time. D. Clean gently and rinse thoroughly. Answer D. Gentle cleaning and rinsing protect delicate tissue and maintain hygiene safely. When providing oral care to a resident with halitosis, bad breath, the CNA should A. Avoid mentioning it. B. Provide thorough oral cleaning and hydration. C. Skip oral care altogether. D. Use perfume to mask odor. Answer B. Regular oral care and hydration reduce bacteria causing bad breath and improve comfort. What is the first step before giving a bed bath? A. Gather supplies and explain the procedure. B. Lower the bed rails immediately. C. Remove all linens. D. Begin without speaking to the resident. Answer A. Explaining care builds trust, while preparation ensures efficiency and comfort. When caring for fingernails, the CNA should A. Soak hands and file nails gently. B. Use scissors to cut nails deeply. C. Skip cleaning under nails. D. Avoid checking for redness. Answer A. Soaking softens nails for safe filing, preventing accidental injury or infection. When providing oral care to an unconscious patient, the CNA should A. Use a large amount of water to rinse the mouth. B. Place the patient in a supine position. C. Use minimal fluid and keep the patient on their side. D. Avoid brushing the teeth. Answer C. Unconscious patients must be placed on their side to prevent aspiration. Only a small amount of fluid is used with a toothette or sponge swab to keep the airway clear and maintain oral hygiene. A resident with paralysis on the right side needs assistance dressing. Which arm should be dressed first? A. The left arm. B. The right arm. C. Either arm first. D. It does not matter. Answer B. When dressing a resident with weakness or paralysis, always start with the affected side first. This reduces discomfort and allows easier movement of the stronger side to complete the process. A resident's dentures should be stored A. In hot water overnight. B. Wrapped in tissue and placed on the bedside table. C. In a labeled container filled with clean, cool water. D. In a dry plastic bag. Answer C. Dentures must remain moist to prevent warping. Storing them in a labeled denture cup with cool water keeps them clean, prevents bacterial growth, and ensures they fit properly. Which of the following helps prevent pressure ulcers? A. Keeping bed linens wrinkled for comfort. B. Turning the resident every 2 hours. C. Massaging bony areas with lotion. D. Keeping the resident in the same position. Answer B. Repositioning residents at least every 2 hours relieves pressure on the skin and promotes circulation, which is essential for preventing pressure ulcers in immobile patients. When assisting a resident with a weak left side to stand from a chair, the CNA should place the gait belt. A. Over the resident's shoulder. B. Around the resident's waist. C. Under the resident's arms. D. Around the resident's hips loosely. Answer B. The gait belt is placed snugly around the waist to provide safe leverage during transfers. The CNA should assist on the resident's weaker side to maintain balance and prevent falls. When providing perineal care to a female resident, the correct cleaning direction is A. Back to front. B. Side to side. C. Front to back. D. Circular motion. Answer C. Cleaning from front to back prevents bacteria from the rectal area from contaminating the urinary tract, reducing the risk of infection. During a bed bath, the CNA should wash the resident's eyes by A. Using a separate area of the washcloth for each eye. B. Using the same side of the washcloth for both eyes. C. Using soap and warm water. D. Rinsing with antiseptic. Answer A. Each eye should be cleaned with a separate corner of the washcloth, moving from the inner to outer corner, to prevent the spread of infection between the eyes. When transferring a resident from bed to wheelchair, the CNA should A. Keep the wheelchair brakes unlocked. B. Place the wheelchair on the resident's weaker side. C. Lock the wheelchair and lower the bed to its lowest position. D. Ask the resident to jump into the chair. Answer C. Locking the wheelchair and lowering the bed ensures stability and safety. This reduces the risk of falls and helps the resident transfer smoothly and securely. A resident refuses to bathe. The CNA should A. Insist and complete the bath anyway. B. Report the refusal to the nurse and try again later. C. Ignore the resident's choice. D. Tell the family to bathe the resident. Answer B. Residents have the right to refuse care. The CNA should respect their decision, report it to the nurse, and attempt again later when the resident feels more comfortable. When assisting a resident to use a bedpan, the CNA should A. Keep the resident's head slightly elevated. B. Leave the resident flat for comfort. C. Leave the bed in a high position. D. Stand the resident up before using it. Answer A. Elevating the head of the bed slightly helps the resident use the bedpan more comfortably and naturally, promoting proper elimination and reducing embarrassment.